Good evening and welcome to our COVID-19 update. I'm Ladi Akiridoluale. Here are the highlights at this hour. Nationwide strike by resident doctors enters day 2. Group insists government should meet its demands, just as Joint Health Services Union gives notice of strike next week. 23 players of Lobby Stars Football Club of Benue test for COVID-19. And COVID-19 restrictions ease in parts of northern England. Bowling alleys, gyms and casinos can now open. Thanks for staying tuned. Let's begin with the fact that the resident doctors strike, which is indefinite and nationwide, has entered day 2 across the country. We have reports on the situation in various parts of the country, but before we get to that, let's start off with the University College Hospital in Ibadan, where the consultants have been put on standby to fill the gap created by the striking doctors. The Chief Medical Advisory Council Chairman of UCH, Dr. Victor Akimolado, in a chat with Channels Television, says services are fairly stable right now, with the consultants attending to patients on admission, while emergency services too remain active. The chairman of the UCH chapter of the Resident Doctors Association, Dr. Adida Williams, says there's no going back on the strike, however, as government has repeatedly abused chances of dialogue but not respecting the agreements reached with the unions. Meanwhile, resident doctors at the Barao Dikko Teaching Hospital and other government-owned hospitals in Kaduna have shunned the strike called by the National Association of Resident Doctors. The president of the Barao Dikko Teaching Hospital chapter, Dr. Said Mohammed, says the Kaduna state government has domesticated the Residency Training Act, which entails full sponsorship of residency training for medical doctors and their well-being. He have calls on the government to fulfill and implement outstanding issues that have been agreed upon by both parties. On his part, the chief medical director of the hospital says that state government is not unmindful of the outstanding agreements it has reached with the doctors. The leadership of the Joint Health Workers Union has given the federal government till September the 13th, which is about a week from now, to address all lingering labor issues with its members or risk a nationwide industrial action. Speaking at an expanded meeting of the union in Abuja, the president of JHESU insists that the federal government has been paying lip service to all conciliation agreements entered with it. The health workers are asking the federal government to pay the COVID-19 hazard allowances for their members and also pay all outstanding salary arrears. JHESU members say they will down tools nationwide if their demands are not met before Sunday, September the 13th.
The Federal Ministry of Health has been playing childish tricks with the implementation of COVID-19 inducement allowances, which was originally designed to replace the payment of 5,000 hazard allowance across board to all health workers, with a 50% basic salary of these personnel on April 21st, 2020. The federal government continues to implement a selective no work, no pay policy, which has dealt decisive blows on some of our members in FMC Owerri, Youth, and Loot. These lingering welfare challenges are: 1, review of implementation of COVID-19 special inducement and hazard allowance, payment of all withheld salaries of members at FMC Owerri, Youth, Loot, including April and May 2018 salaries. In the event that the 5 demands are not met by midnight of September 13th, 2020, USU will commence a nationwide 7 days warning strike of our members in all FHIs. The state and local government health institutions are placed on notice for further directives to join the fray.
while Johesu prepares for nationwide strike action next week. We can take now the update on the situation report of the ongoing resident doctor strike nationwide. Our correspondent Gimba Omar has that.
Gradually, activities drop in the hospitals across the country. University Teaching Hospital Uyo in Akwa Ibom State is hard hit, evident in empty long corridors. Wards are deserted. Nothing but silence can be heard. Bedsheets lie in a pile. Filth litters the surrounding. The resident doctors insist the government is to blame.
Not a new strike, just a resumption of the old strike, which we suspended in the interest of the suffering masses.
The doctors' resolve is final. Sustain the strike. Say not only in Uyo, but also in Umahia, the Abia state capital, where the doctors, after an emergency meeting, decided to down tools in clear instructions.
Our members, who are people below the rank of consultants and principal medical officers, strike.
Up north, the Usman Danfodio Teaching Hospital in Sokoto lies almost empty, but for a few who chatted in clusters. A handful more lined this corridor, waiting to be attended to.
As doctors, as residents in training, we need to be taken, the government need to take care of us so that we can take care of the populace adequately.
A 21-day ultimatum to the government to meet the doctors' demands lapsed on the 17th of August 2020 with no outcomes or results, fueling frustration for the doctors. In Bauchi, the Abubakar Tafawa Balewa University Teaching Hospital worsens the pictures. The corridors turned rest grounds, the few sit on mats for comfort. The intensive care unit deserted.
Our members that are in the COVID-19 treatment centers are exempted from the strike because of the pandemic.
Down south in Lagos, the strike in Lasuth gives a totally different feel. It appears, though, that there is no strike in place. People within the hospital premises moved freely outside, wearing their masks. But trouble lies beneath the surface. The secretary of the association tells me
the agitation mainly for one is the salary disparity. This thing has been there for a very long time. We want this salary disparity issue to be addressed. Two is the Medical Residency Training Act. This is a national act that is governing the program of residency in Nigeria.
It's not the first time resident doctors will embark on a strike. This one, however, is coming when the COVID-19 pandemic rages on. The demands of the resident doctors, though meager, are indeed crucial for them to be able to attend to the welfare of their patients. Gimba Umar, Channels Television News.
All right, let's talk to the national president of the Association of Resident Doctors, Dr. Ali Sokomba, who is in our Abuja studios. Good evening, Dr. Sokomba. Thank you for your time this evening.
Good evening. Thank you for having me.
You've been in this position not too long ago. We were at this point where the strike had, in fact, started and then was called off because an agreement was reached. And yet here we are at this point. Can you itemize for us what are the basic things that your union wants for its members that have not been fulfilled?
Thank you very much. I would like to state categorically that all the demands we had as far back as June 15th, when we started this strike, have remained unaddressed, except, of course, the fact that some personal protective equipment have been made available in some of our hospitals. So all the demands we have presented to government back then have remained unaddressed. It may sound as if some efforts have been made, but efforts that the government have made over the few weeks that we have been engaging them are efforts that have remained on the pages of newspaper. We've heard on several instances that following the intervention of the National Assembly Speaker, some funds have been provided to cater for the residency training funding. but that has remained at that level. It has never translated to our members getting the needed funds they need to proceed with their training. We've also heard that insurance companies have been procured to provide insurance cover for our members, as well as make payments for the death in service benefits to the beneficiaries of our members that have died in the course of service. Again, that has remained at that level, as none of our members, not even a single one, has benefited from the death in service benefit that the government claimed they have made payment for in our stead. Again, we have also heard that the government claimed they have spent billions of money making payments for the COVID-19 hazard allowance. Again, only 2 months of the 6 months that was agreed with government has so far been paid. And it might interest you to note that for the month of June, 6 hospitals out of the 54 federal hospitals were paid and the rest were abandoned. So all of these points to the direction that this government has no sense of sincerity and have no plans of making this payment at all. So we
let me jump in, Dr. Sokomba.
From this government.
Dr. Sokomba, let me jump in at that point and just ask that in terms of the residency training program, the reports we have indicate that the problem is that many of the states for which quite a number of your members work have not domesticated the enabling law that makes this possible. For example, in Kaduna State, just to take an example, some of the doctors who should be under your umbrella in Kaduna State say they won't be joining because that state has domesticated the Residency Training Act, and that therefore they are benefiting from that, and that reason of the strike does not apply to them.
Yes, I think I need to make a clarification here. The federal government domesticated the Medical Residency Training Act in 2017. And since then, the federal government has not implemented the Medical Residency Training Act they have domesticated as far back as 2017. Fortunately, some pockets of states have also domesticated the Medical Residency Training Act and have been implementing the Medical Residency Training Act, just like Kaduna State government for the Barau Diko Teaching Hospital. So at the federal level, the act is already in place, it is already enacted, but it is not implemented. And we also have in state hospitals, especially most state hospitals in Nigeria, not domesticating the act, let alone implementing. So it's a problem all the way. Federal level not implementing, though domesticating the act. And in most states hospitals, the act is yet to be domesticated. So generally, there's a problem with the Medical Residency Training Act. At the federal level, it is domesticated, not implemented. At the state level, some states are implementing, while some other states are not implementing.
The issue of the disparity, because one of those that spoke to us in the report preceding this discussion also talked about the issue of disparities in allowance between categories of personnel, whether you're working for federal authorities or state authorities and so on, that disparity ought to be removed. What's the situation with that? Is it that nobody has acted upon that?
Yes, that has continued to remain one of the most prominent concerns we have presented to state government to address. It's unfortunate that doctors belonging to the same rank, having had similar training during the course of their training, attending to similar patients, are treated differently in Nigeria. It's unfortunate that this is obtainable. We have continued to advocate for universal applicability of government policies to ensure that there is no disparity between doctors practicing at the federal level and those practicing at the state level. And that disparity has continued to remain, and that is one of the reasons why we are on this strike. We want all doctors' salaries to be on the same scale and paid equally, because when we see patients, there is no distinction between whether this patient is being attended to by a federal working doctor or a state working doctor. And so it's the same diseases, the same patient, the same training we have. And so there is no basis for disparity in pay of doctors at federal level and that's of the states. So that has continued to remain a problem. And we have continued to engage state governments, especially at the Nigerian Governors Forum, but we have not made significant effort in getting that addressed.
some of those with whom you should be engaged in this dialogue, in this discussion, have accused you, some of the government authorities, some of the government officials, have in fact accused your association of being hasty, of being unaware, or of pretending to be unaware that this is not a one-stop thing, that this involves many agencies and many bodies. For example, it involves the Revenue Mobilization and Fiscal Commission. It involves the Federal Ministry of Finance. It involves the Federal Ministry of Health. As you've pointed out, it involves several states, and that these things do take some time to put together. The Minister of Health, the Minister of Labor and Productivity is calling for a meeting tomorrow. By the way, will you be attending that meeting tomorrow that the Minister of Labor and Productivity has called?
Sure. Well,
when you say sure, what does it mean?
The Minister of Labour has called. We will continue to attend and reach out to stakeholders that have invited us to meetings. So we will be attending the meeting for tomorrow. Secondly, on the issue of us being hasty, I think that is not correct. First, the law on Medical Residency Training Act was enacted in 2017. And for the past 3 years, we have been engaging government. I don't think if government is serious about getting that addressed, we will need to be engaging government for 3 years. Every year, we get to hear that the residency training funding has been captured in the budget, but it never translates to these funds getting to the beneficiaries. So that also demonstrates that there is no commitment whatsoever on the part of the government to see that this medical residency training funding is put to rest for 3 years. So I don't think that is being hasty. Secondly, on the issue of the review of the 5,000 naira hazard allowance, just as our colleagues Johesu have mentioned, that this has been on for some time now, and we have requested that the 5,000 naira hazard allowance be reviewed. The government has agreed that it is long overdue that it should be reviewed. In fact, at some point, His Excellency, the Honorable Minister of Labour and Employment, has said that that has been the hazard allowance even when he was practicing as a doctor. It has been on for the past 30 years, and it has remained 5,000 naira. And he corroborated the need for that to be reviewed. And we have been discussing this. So what that means is that the 5,000 naira hazard allowance has remained for 30 years, and we are calling for that to be reviewed. So I don't know what is hasty in demanding that something should be reviewed for 30 years. I don't know what hasty that could be. That maybe we are expected to remain for another 30 years to continue to negotiate for that 5,000 naira to be reviewed. Again,
let me jump in because of the time. Let me jump in because of the time and ask you. I'm sorry. Let me jump in because of our time and just ask you. At tomorrow's meeting, what will be the minimum that you can be offered that will be satisfactory for you to take to your members and say, okay, let's hold on to this while we negotiate others?
Well, I wish to let you know that we have had this discussion again satisfactorily with the stakeholders. We have pointed out to them what we think is reasonable and what we think government can do, which they have unanimously agreed that it is implementable. And all we were expecting them to do was to implement these agreements we have reached with them, which includes implementation of the medical residency training funding, which has been adequately provided for in the budget by the Honorable Speaker of the National Assembly, the payment of the COVID hazard allowance as promised by the government at their own volition, and also the review of the hazard allowance from the 5,000 naira that it is right now to something reasonable, and lastly, the procurement of life insurance for our members, which the government claimed have been paid for. So all we are asking is that all the effort the government has initiated in getting our concerns addressed be pursued to a logical conclusion.
Indeed, thank you very much, Dr. Ali Sokomba, and one can only wish you the very best of luck at tomorrow's meetings and other engagements that you will engage in on behalf of your members towards resolving this matter. Dr. Ali Sokomba, National President, Association of Resident Doctors, thank you for your time on our COVID-19 update. 23 players from Lobby Stars of Markodi in Benue State today undertook the mandatory COVID-19 tests at the Benue State Isolation Center in the Benue State University Teaching Hospital to determine the health status of the players ahead of the commencement of the Nigerian Professional Football League scheduled to start in October. The vice chairman of the Makurdi club, Mr. Mike Idoko, says any player that tests a negative will be integrated into the close contact training group of the team, while those yet to take the test will continue to train in isolation. Our correspondent, Pius Angbo in Makurdi, has more.
23 out of the total number of players applied their trade at Lobby Stars, Benue State, have tested for COVID-19 this morning, just here at the isolation center at the Benue State University Teaching Hospital. The management of the club says they would want to go into close contact training. As such, everybody must be tested to determine their status of COVID-19. And so, once the result is back from NCDC, they would know who is positive, who is negative, and that would determine who will play for the team.
If you are not tested, you won't play. If you are tested and the result comes out negative, then you're 100% fit to play. And of course, we are going to follow the social distance and what have you, to make sure that we don't fall short of getting NCDC, rules and regulation.
In preparation for the beginning of the new season come October 2020, the club management is insisting that they will do everything they can to ensure compliance with the rule of social distancing and a bit of non-contact sporting system as they start preparation for the new season. However, the players say they are ready and they are in high spirits to bring home all the trophies available for contests this season, and they would also want to go to play continental games.
The desire is always to win. All the trophies are available. All the trophies are out for contests. We contested. This season will not be any different. We've always had the good support from the government, from the management, and the coaches have always been working hand in hand with the players. The united front to be able to attain results, attain all our expectations. So hopefully by God's grace, we'll put in all our efforts, and by God's grace, we shall come out victorious this season.
From the Makurdi Isolation Center here at the Benue State University Teaching Hospital, Pius Angbo reporting for COVID-19 update.
In the last 24 hours, 218 persons recovered from COVID-19 in Nigeria in 12 states and the FCT. 95 people recovered in Plateau, Edo 38, Rivers 25, Ogun 15, FCT 12, Ebonyi 12 as well, Ekiti 5, Kaduna and Akwa Ibom 4 each, Bayelsa 3, Oyo and Osun 2, and Imo 1 recovery. But the country also recorded 4 deaths, 1 from Rivers, 1 from Ebonyi, the same as Oyo and Sokoto. New cases from the Nigeria Center for Disease Control, the NCDC, has put at 155 and puts the total confirmed cases at 55,160. The cases were reported in 15 states and the FCT, of which Lagos had 42, Plateau 25, Rivers 16, Ebonyi 10, the FCT and Abia as well as Ogun had 9 each, Osun had 7, Katsina and Kaduna had 6 each, Ekiti 4, Taraba as well had 4, Edo 3, Anambra and Akwa Ibom had 2, and Kano 1 case. The total sample test conducted in Nigeria so far now stands at 426,803. Traders at the Minakure Ultramodern Market, that's in the Niger State capital, the biggest market in fact there, have expressed resistance to the use of face masks, saying hunger won't let them abide by the rules. This is even as the state government says the ban on interstate travels no longer suffices and that the attention now is on the compulsory use of face masks. Emperor Simon brings us the update.
It's been a rainy evening here in Minna, the Niger State capital, but in spite of the rain, we've been going around to get more updates on COVID-19. Now, as of today, Niger State has a total of 244 confirmed positive cases of the virus, and the death toll is still at 12. In terms of compliance with the use of face masks, we were earlier at the Minna Central Market where we saw that many of the traders do not use face masks. Now, we sought to find out from some of them why that is so. And they say that they're hungry and they have no money. And as such, government cannot be talking about use of face masks in the midst of hunger. That's what they say.
When you chop belly food, then that's when you cover your mouth and cover your nose. But when somebody is hungry, if I cover my mouth, I should cover your own and maybe you eat belly food. So if there's anything that you can give to me, whether if you give it to me, I will collect you. Because it's money I haven't eat. What me? I'm a child and I have children in my home. I haven't eat. So that's the thing.
I'm not scared, actually, because I feel it's not even real to me.
How to save their head? You need leader to back us. You need leader to assist us. You need leader to help us. No one, if the people are backing up, assisting us, people will say, yes, we remember to wear face masks.
In terms of the ban on interstate travels, the state government says that there is no longer ban on interstate travels, a sequel to the decision of the federal government to even open the airports. And they say that people can now travel from any part of the country to the state, but putting into consideration the safety measures that have been rolled out, including compulsory use of face masks.
A ban has been lifted long before now, including interlocal government. So there's free movement you can see everywhere here and there. The biggest factor in containment of COVID-19 now is wearing of face masks, which people must abide by.
That's the update from Niger State. Empress Simon for COVID-19 update.
Let's talk to Dr. Alero Roberts, consultant public health physician. She joins us from the Ikwe area of Lagos via Skype. Good evening, Dr. Roberts.
Good evening, Ladi. Nice to be here again.
Trust me, I'm not going to start off this time with the issue of face masks and the disparity between what the people are saying and government. Let's talk a little bit about the welfare of medical personnel. I mean, you've got the resident doctors on strike. You've got Joheso threatening a strike next week on some of the same issues. Of course, people in your category may not be able to join those kind of strikes, but what do you make of all of this standing or coming at a time when we are dealing with this other issue, the COVID-19 pandemic, and all that that entails?
To be honest, Ladi, I'm supposed to be a very well brought up young lady, but this kind of thing makes me really, really angry. You know, it's so unfair because all the health workers are asking is what is already owed to them. They have done the work. They're asking for arrears. They're asking for a fair wage. And these are the same health workers that turn on the television in the evenings, listen to the radio, and hear the huge sums of money being bandied around by places like the NDDC, the NNPC, hearing huge sums of money being spent on things that have no value, as it were, that can't prolong life. These are health workers that are paying some of them the supreme price with life and limb. And they're asking to be paid what is already being owed to them. They're not even negotiating the future yet now. The 7 things they have asked for is monies that are already being paid, already being owed to them for work they have already done. I mean, come on. Where else does this happen? Who does this?
The other part of this, of course, is that because things are now easing up, quite a number of these people have expressed the opinion that if it wasn't happening before because of restrictions, it's quite possible that this may expedite the whole issue of brain drain.
I happen to know of 9 people whose dockets and letters and whatnot that I have signed or recommendations I have written, that as the airports are open, you will look left, you will look right, and they'll be gone. Because let's be honest, countries somebody did not have a job 2 months ago, sat the exam, got a job, and is just literally waiting for a flight to leave. So what are we talking about? Doctors, nurses, physiotherapists, they are highly prized outside the country. And this is a country that clearly doesn't even appreciate that the sacrifice they are putting through. Their children have to go to the same schools. Or will a doctor send his child to a school that cannot assist that child in becoming a doctor as well? I mean, it's absolutely absurd that we should be in this position at this time. It's absurd.
But of course, there are amongst the demands of some of the issues that have created concern is the issue of disparity between categories of medical staff. I mean, you pointed now that you've got nurses, you've got physiotherapists, you've got medical doctors, the general practitioners, you've got the consultants such as yourself and other categories. I mean, there are established traditions and laid down principles that govern this. So why are these subjects of contention yet again?
Well, to be honest with you, we can deal with those issues between us as professional colleagues. Let's even just deal with the issue of what is being owed to all of them for work that has already been done. Then there are the issues of the disparities, because this is a country that clearly doesn't believe in the rules, the international rules or global standards or global best practices. Or, I mean, I'm not even going to get into that first and foremost. Right now, we're on the verge of a major crisis. And if people can't even see that, then I'm really very sorry. We're on the verge of a major crisis because if Johesu and the NARD and other cadres of health professionals lay down tools and say they are not going to work, what do the masses do? What do pregnant women do? My issue will always be with pregnant women and babies because there's no time. They present with issues and things can go from 0 to fatal in minutes. And we're already seeing these things happen. I mean, a government that's responsible needs to address this and address it quickly and expeditiously.
I want to ask you, of course, about the link possibly between the attention being paid to this and the seeming coincidence with the supposed going down of the number of cases, the flattening of the curve, and therefore the removal of a certain sense of urgency from what we've been dealing with in the last 6 months. Is there some level of correlation between these two issues?
I don't think so. I don't think so, sincerely. There are many reasons why the numbers will be going down, and frankly, it may be good. It may be just that, people are just tired and complacent and therefore not presenting for testing. But I keep saying it, we don't see the burden of illness or death, the excess of burden of illness or death. But that doesn't mean that we're not dealing with other things. Like we still had a Lassa fever outbreak that we haven't managed to put away. And, if in the DRC they're having a measles outbreak, which they are having now, nothing stops it from happening again here. I mean, we have seen a breakdown in supply chains, which means that there are other hidden things that can start popping up on the horizon before we are ready to deal with it. And certainly, there's one major epidemic we're going to see. That's going to be a lack of trained healthcare personnel.
This doesn't sound very good, Dr. Roberts. Thank you. Thank you for your perspectives this evening. One hopes that this gloomy picture will improve as the days come by or as the days go by with us. Thank you so much for your time this evening.
Thank you for having me.
Outside our shores, England's Chief Medical Officer, Professor Chris Whitty, says COVID-19 rates are now rising, especially amongst people aged 17 to 29, as Health Secretary Matt Hancock urges young people in particular to stick to physical distancing rules. The United Kingdom recorded 2,948 daily confirmed cases of COVID-19, according to government data published earlier on today, the second biggest 24-hour rise since May. Our correspondent in London, Juliana Olainka, has more.
COVID-19 cases are on the rise in Britain. The government's decision to ease lockdown restrictions at the start of June was a gamble. And new data suggests the fallout may lead to a cold, bitter winter for Prime Minister Boris Johnson. On Sunday, UK authorities announced 2,988 new cases, the highest figure since the 22nd of May, while a further 2,948 cases were reported in the 24 hours to 9 a.m. on Monday. Although estimates suggest there are about 100,000 cases a day at the peak, this recent rise in cases has caused alarm within the government.
Well, we are concerned about this rise in cases, of course we are, and it's predominantly amongst younger people, but of course, younger people can pass on the disease to their grandparents, and we do not want to see that. The first line of defense for everybody, no matter who you are, no matter how old you are, is to follow that social distancing so that we don't pass it on to people who will end up hospitalized or worse. Now, workplaces are COVID secure, schools are COVID secure. It's really important that people follow the social distancing at all times.
It's the lack of social distancing that has led many to believe the government will soon announce more restrictions for the entire country. According to a Downing Street source, the maximum number of people who can legally gather in a house in England will be cut this weekend to try to stop another coronavirus spike. Although the number of patients admitted to hospital and fatalities have remained at a low level, experts warn the new figures should be treated with extreme caution. As Prime Minister Boris Johnson attempts to revive the British economy, the fact remains that coronavirus is ever present on these shores, and a second spike could be on the horizon. Juliana Olayinka, reporting for Channels Television News in London.
Let's talk now to Juliana. She joins us from the British capital. Good evening, Juliana. Let me start straight away by saying one of the places where there's been this rise in the cases is Bolton, which is in northern England, isn't it?
Bolton is in northern England. Good evening, Laddie. Yes, earlier today, the Health Secretary, Matt Hancock, who was just speaking in my report there, he delivered a statement in the House of Commons, an urgent statement, saying that effective immediately, Bolton in the north of England would be going under lockdown. They are seeing a really steep increase in the number of cases. Now, there are 120 positive cases of COVID-19 in Bolton per 100,000 people tested. And if you compare that to the British government's strict quarantine restrictions, in Spain and in Portugal, the number of cases per 100,000 was 20. And you had to self-isolate for 14 days. So this 120 cases is the highest infection rate in Britain. So now restaurants, pubs, bars have all had to close. You can only open if you are delivering takeaway. And even if you are delivering takeaway, you have to close between the hours of 10 p.m. and 5 a.m. And we're seeing this across pockets of the four nations. Also in Wales, there are local lockdowns. We know that last week when I was speaking to you, the First Minister, Nicola Sturgeon, announced a lockdown in the Glasgow city centre, and other parts of Western Scotland do remain under strict lockdown. And the question that I suppose most people in Britain are asking is when Prime Minister Boris Johnson will be imposing a national lockdown. And that's what all of the suggestions are leading to.
The other thing here, of course, is that this has had profound impact on something else that could affect the living standards and the living of the ordinary British, which is something that's falling off the headlines somewhat, Brexit.
I was wondering if I would be able to curb the term Brexit during this crossover, but of course I can't. Brexit is a major issue at the moment. In fact, I've got to tell you that Boris Johnson is really grappling with a lot of issues. Not only is Britain in its deepest recession in 300 years, he's given himself less than 40 days to secure a Brexit deal with Brussels on the 15th of October before they have their EU 27 council meeting. And he's facing a revolt within his government. The former Prime Minister Theresa May stepped up in the House of Commons during another urgent question, this time with the Northern Ireland Minister, accusing the government of backtracking on their international treaty, which is the withdrawal agreement, which was, voted by members of Parliament last year, taken to Brussels, worked on tirelessly, finally agreed, and now, just a few weeks before Britain is due to leave the European Union for good, they want to change some amendments within this treaty. So there is a lot of serious issues going on in Britain at the moment. But I've got to tell you, it does appear for the first time since coronavirus hit these shores that Brexit is the main deal. We've got the Brexit chief negotiator, Michel Barnier, in London. He was in Downing Street for a series of pretty tense talks that did see a slump in the pound. It was at its lowest level for 6 months. But these are serious issues, and it does look as if we could be heading for a no-deal Brexit. But I've got to say very quickly that some senior members of the Bank of England do say that even if we do crash out of the EU at the end of the year, that will be dwarfed by the issues that have been raised in Britain due to COVID-19.
Indeed, they probably would. Thank you so much, Juliana, for that. Thank you for the report here, and do continue to stay safe, lockdown or no lockdown. All right, then. Finally, doctors treating former Italian Prime Minister Silvio Berlusconi say signs of recovery from COVID-19 are reassuring. The 83-year-old was admitted to hospital last Thursday having contracted COVID-19. This comes as the total number of cases in Indonesia surpasses 200,000 and the death toll is above 8,000.
Chinese President Xi Jinping has presented awards to those he says are role models in the country's fight against the COVID-19 pandemic, saying the country's national strength enabled it tide over the difficulties brought by the virus. He also commended the abundant material bases accumulated, the complete industrial system, the strong sci-tech capacity, and rich reserve of medical resources stored over a long period of time to provide a robust support for its epidemic prevention and control. Medical experts say the coronavirus situation in the United States is at its worst due to a lack of proper guidance from authorities. The country remains the worst-hit nation by the pandemic, with 26,071 new confirmed cases recorded on Monday and more than 6.2 million cases and over 189,000 deaths. The number of infections in over 20 states keeps increasing as well, especially those with much lower population densities in the central and western part. Spain says the number of cases needing hospitalization has increased slightly, with 7,892 beds currently occupied by COVID-19 patients or those with a high probability of having the disease. The health ministry says hospitals are not in the situation they were at the start of the pandemic, where they were on the verge of collapsing.
That's our COVID-19 update for tonight. Thanks for joining us. I'm Ladi Akere-Duluali. For details of all our stories tonight and indeed others, do go to our website, that is channelstv.com. Good night.